Well, we've talked about the most important part of getting ready for surgery, which is, in my opinion, understanding what you're going to do after surgery. Now let's talk about the details of the physical therapy that's very important right after surgery. And the most important exercise is to wear your sling. The second most important exercise is to do pendulum activities, which are the activities that you are taught by the physical therapist and you're allowed to do 3 to 5 times a day after surgery. Essentially, this activity, which is simply letting the arm dangle and letting it rotate without contracting the muscles, is designed to keep the shoulder lubricated and to keep the blood flow to the shoulder so it does not get too stiff. And by not using the muscles, you are not putting stress on the repair. Again, let me emphasize this. By not using the muscles, you are not putting stress on the repair. So this is a safe exercise, and this is the approved exercise that you should be doing immediately after surgery. The second exercise that you can do is what we call passive external rotation. In this exercise, you're literally holding a bar. And with the non-operative side, you would gently push the arm out to the side. This is also to keep the shoulder lubricated and to keep the blood flow so that the blood flow is at its highest level. And the final exercise that you'll do is what I call scapular contraction. With your hands on a table, you simply are squeezing your shoulder blades together to retrain the scapula and to retrain the many muscles attached to the scapula to start sitting in the correct position. Those 3 exercises are the most important related to the shoulder. There are 2 other exercises that you will be doing in the post-operative period in the first 6 weeks. The first is simply to flex and extend your elbow, to keep the elbow loose, and to extend and flex your hand, to keep your hand and wrist loose. Those are the approved exercises in the critical phase 1 after surgery, which we call protected motion. The other exercises you will go over with your physical therapist, and you will get an exercise kit to do at home, and those will be covered on a one-on-one basis.